Hey guys, here's your week 2 wrap up. So this week we talked about subacromial impingement syndrome. So we first started out talking about our exam standardization. So I wanted to touch on this and make sure that we're all on the same page as far as when it comes to standardization. So this would be uh, doing something very consistently. It helps to maximize compatibility, um, ensures our quality, ensures that it's repeatable, um, and it should be filled with best evidence. Atul Gawande wrote Checklist Manifesto, and if you haven't read it, it's a really good book. It just talks about, we know the things to do in our examinations or in any procedure, but we're not always consistently doing every single step. And so that's what that was about. And if you have something that's standard, everybody's not going to fit into that, obviously. And that is where having that standardized format facilitates a custom process that you can venture from that standard um, checklist, or however you want to think about that, if need be, if it's justified. Um, but just unwarranted variability in our examinations is not something that we can claim is really improving our quality of our examinations, just because we're quite fallible and don't consistently do things the way that we necessarily should. So um, on to diagnosis. So this week we had Michener in our required readings, and we had Park in the optional readings. So I thought I'd put together a little bit of a comparison. This is absolutely for after you have ruled out that pain is not coming from somewhere other than the shoulder. So you need to fully rule out the cervical spine. And in my mind, you can't do that without overpressure. If you have a high suspicion and you don't get it with overpressure, then you need to do accessory motion testing to the cervical spine to be able to fully rule that out. So we see the 5 tests for Michener, 3 for Park. Got a little bit better numbers on one versus another, and that's probably due to the number of patients that they had in each, and some of the blinding perhaps that was in there. But either one of these are really actually good tests to use. No study is ever without some fault, but either one of these, I remember the Park one, so that's what I do. You may choose to use the other one. So some other diagnoses that I think are relevant that we didn't really talk too much about. We have bicep tendon dysfunction, SLAP lesion. Those things will come up in week 4. So hold tight on those. We brought up a recent Dunning article about causing posterolateral shoulder pain. They've cleared subacromial impingement through a negative Neers test, and palpation of rib 2-3 or rib springing there reproduced the patient's pain, and it was relieved with thrust there. So, and then you always want to make sure that you're ruling out first rib. Your CRLF test, cervical rotation lateral flexion test, is a good one to do that. So if we move on to treatment, everybody did a pretty good job of compare and contrasting what you do with bang and dial. That's great. Also came up about thoracic manipulation. There's quite a bit of evidence to use thoracic manipulation. Not so much that it will change the mechanics of the scapulothoracic joint. We had this discussion in several threads. That has really not been shown, and actually kind of been disproven that changes. Although we could argue that it hasn't been studied in the best population with the best methods. But Mencken put out a CPR for patients with shoulder pain that are going to respond to thoracic manipulation. I would caution you to not only do thoracic manipulation in those who fit that CPR, because you're likely missing a large portion of the population that would respond favorably. And then mobilization with movement also we talked about for treatment. So for our shout-outs this week, Dan and May, I think you guys were on here last week. Good job consistently putting forth high-level evidence out and excellent reflection in your posts, and then good dialogue with peers and good managing your own thread and people asking you questions. So great job. So we're having some trouble with our response posts. The deadline has been moved from Saturday at noon to Friday at noon, and there was a large portion of you guys that didn't seem to get that message or not be able to meet that deadline. So be sure that we can do that next week. If you think me moving it back to midnight will make a big difference, then I'd be glad to do that as long as we get some quality posting. I just want to not make people have to, if they're responsive early in the week, that they don't feel like they're waiting on those last minute stragglers to come back and make response posts. So just try to get those done early and manage your own thread. So you will lose points if you do not do your response posts. You will lose points if you do not manage the questions that people pose to you on your threads. It's just a bit disrespectful, and so make sure that you are doing that. Also, I need your project topic and your method of group presentation. There wasn't a deadline on Moodle, so just get me that today or tomorrow. And thanks. I'll see you guys on the boards next week.